So today, what we're focusing on is identifying if you have some type of co-infection, things to look for that may trigger this interest and the need for testing, what that testing looks like, and how someone like Julian can get you back on the road of starting to feel like your old self again. So, Julian, you take the ball and run with it, or the puck, if that's your expertise.
The puck I prefer.
Sure.
So yes, with Lyme and its testing and its, obviously we can never miss the co-infections part of it. There are certain labs that we can utilize. They're more testing the immune markers. So they're testing your IgM and your IgG in response to, hey, I have, IgM elevated, which means you have an infection, or IgG means you've had the infection, right? Um, those are good markers because it can tell you if you've had past exposure to these organisms. Also, it can tell you if those past exposures have been reactivated,
Mhm.
right? And when they have been reactivated, that's a good clinical science. Like, okay, what's going on in the terrain of that individual? Like, how do we understand what's going on in that individual's terrain that has now reactivated this specific, type of organism, whether it's, Lyme Borrelia, whether it's co-infections such as Bartonella, right? So it's always addressing as a whole, but the testing is good because it can help identify not just, hey, I have one infection. It can give us more clinical signs and be more precise on treatment because now you're looking at the whole individual as the whole picture and treating, what's underlying too at the same time, right? We never want to just, especially with Lyme, you never just want to focus in on, hey, here's your Lyme Borrelia burgdorferi herb, and we just try and kill it. No, because that infection is thriving given the terrain of the individual now, especially if this become reactivated, right? That means,
Right.
there's been a lot of triggers during their life, whether it's the trauma trigger, whether it's the environmental trigger components, whatever it may be,
Sure.
right? Um,
Can I jump in?
so
I just want to see. So how would someone who has no knowledge of ever having like a tick bite, they just don't feel well? What are the type of kind of characteristic symptoms that someone with this previous or current infection, what they might be able to say like, hey, you know what, I have some of these.
mhm.
Maybe I have Lyme or I have one of these other co-infections.
Yeah, so I'll dive into the symptom picture and how they can kind of overlap,
Sure.
but there are ones that always stand out in specific cases when we talk about even like the co-infections, and even we'll even throw mold in there too.
Oh yeah.
So Borrelia, Lyme, Borrelia, everyone just knows Lyme as just being this one type of infection. Um, but now there's multiple species, but the symptoms that kind of coincide with it would be chronic fatigue, chronic headaches, migrating arthritis. So they're having arthritis in different parts of the body, which kind of fluctuate,
Mhm.
muscle aches and pains, fevers that, they relapse, get a lot of fevers, swollen lymph nodes, flu-like symptoms, stiff neck, and then 300 plus symptoms may be attributed to Borrelia. So if you're having multiple symptoms systemically for, months to years, kind of a red flag goes up. It's like, hey, I think there's tick-borne infection involved, right?
Because
The
another sign is that when people are getting treated for one thing and it sort of gets better and then it comes back. And it's almost like, well, I keep getting these different treatments and they help initially, but it's not I'm still where I'm at, where I was at the beginning.
Exactly. So if people are on specific protocols, let's say, and month after month and they're still feeling unwell, that's another clinical insight to be like, hey, there's something deeper here that needs to be addressed because the immune system is not fully firing and functioning properly because I have bigger guys that are basically hindering the immune system and hindering the terrain of that individual, right? So that's another, in our clinical world, right? If we put someone on protocols and they're just not getting better, we should think tick-borne infection for sure.
Wow. Okay.
Another subset of co-infection. So we have Babesia. So Babesia is different from Borrelia Lyme, whereas it's considered an intercellular parasite, right? So these are often overlooked. They're hard to prove on just general labs. It's considered the North American malaria. Um, Big symptoms is severe brain fog and cognitive impairment, drenching night sweats, day sweats, air hunger. So that's a big one if they're having air hunger, like especially during the nighttime, and
Like
heart
you
pulp.
can't catch they can't fill their lungs up. I see. Yeah.
Like they can't catch their breath a lot, like they're
Mm,
like gasping for air all the time.
interesting.
Cardiac palpitations. So like, you get into the whole POTS syndrome, right?
Yeah.
From sitting to standing, they get dizzy or their heart starts to kind of thump and beat hard. Headaches, especially at the crown and frontal area, dizziness, loss of balance, nausea, numbness and tingling, burning pain, anxiety, and then you do get a flare every 4 weeks. So if you have a lot of like the cognitive impairment stuff with like the heart palpitations and you're feeling symptoms every 4 weeks, big clinical sign for Babesia infection,
Wow.
right? We move into Bartonella. So Bartonella is considered cat scratch fever, right? You can get transmission from a cat scratch, as you know, plus other factors. So this person will just be like the anxious type. They'll have unusual neurological sensations. They'll have a lot of anxiety, anger, irritability, panic attacks. They'll also have eye pain, visual disturbances like eye floaters, for example. Some present with skin tracks on their back, so they'll have like these marks on their back,
Mm.
which is a big clinical sign. I would say that's probably one of the hugest signs for Bartonella. They'll also get like very deep bone pain if they're having pain in the soles of their feet. That's a big one. They'll have lumps and bums. They'll have day sweats, bowel issues like IBS types of conditions. They'll have endocarditis, myocarditis because Bartonella likes to infect the red blood cells, so like the linings of the vascular system. Some have seizures and some have like these electrical shock sensations where they're always feeling like there's, pins and needles or zapping all over their body, right? So that's another big one too.
These all those three major diagnoses, I think a lot of people will be like, I think I've had that, or I feel that sometimes. They sound like they're pretty common symptomology. Again, some of them are some unique symptoms, like the scratches and stuff. That's different. But why do you think that it's so underdiagnosed? Because it sounds like it's probably quite prevalent.
I think it's very underdiagnosed because we're not looking for it too, right? And from the conventional side, they can test like Borrelia and Bartonella serology.
Yeah.
When we go back to, even if you find a tick bite, like it can, in 6 hours, it can become chronic, right? So it's like
Wow.
you literally have to go to the doctors within that 6 hours potentially and get blood work done. And hopefully it shows up on blood work because those infections are going to leave the bloodstream and they're going to go burrow into tissue. They're going to hide from the immune system, right? It's like molecular mimicry, right? Where they're basically skewing the immune system to be like, hey, like I can hide from you and you'll never pick me up from a blood draw standpoint, especially like the serology, right? Whereas if we're actually doing testing from, the functional sides, right, the alternative medicine, then we're looking at like, what's the immune markers looking at? Do you have an active exposure from your IgM markers, or
Mhm.
have you been exposed in the past, or has that exposure, been reactivated, right? So I think a lot of people aren't diving into it because I think there's obviously a lack of knowledge, lack of understanding around the whole, let's say, chronic infection world, especially in like the tick-borne area. And even clinicians, like a lot of us are not educated or taught this in school, right?
Not at
It's like,
all.
right, it was either people go through their own experiences or they're seeking out additional education, whether it's from, anywhere North American based, or obviously Germany is a little bit far more advanced than us, especially in like in the testing aspect where they can do spot testing, they can look at different immune markers, whether it's, bacteria like Lyme or even Epstein-Barr virus, or other parasites, etc. So it's always a cluster going on, right? And that's where like the whole terrain theory comes back into play. We have to understand, the patient's, circumstances that are making they're making the body hospital to infection,
So
right?
that leads into that definitely my next question. It's like, so what are those factors? Like, why would, let's say two people, they both got like bit by a tick, and one person will present and the other person will be like, I didn't have any impact on me.
Yeah, so terrain, right? So what's the immune system doing at that time for that individual, right? So, and that's where kind of mold comes into the picture too, where, mold exposure can trigger Lyme to flourish or
I
vice versa, right?
see.
Lyme can dampen the immune system, and then I start to become, I have like chemical sensitivities. Now I'm sensitive to environments. Now my body, the epigenetic standpoint is changing how the cell is reacting to the environment. And then it's like downstream effects, right? It's like shuts down liver detoxification, shuts down kidney detoxification, lymphatic stagnation, and then we start to eventually, again, that whole barrel effect, right? We start to build up, right?
Mhm.
And eventually it causes dysfunction in the individual, which is causing, what's called limbic system and vagal dysfunction, right? So the limbic system is basically perceiving everything as a threat for those individuals because they're so on high alert to now the environment. Now I have tick-borne infection involved. Plus, I probably have other infections maybe going on. Maybe I have leaky gut going on at the same time. And now it's like this whole cascade of inflammation, right? And
Sure.
that inflammation is different in everyone. The goal is to help, okay, what are the inflammation driving forces, right? And then knowing the main symptoms of these other, hey, co-infections or Lyme or mold, that's how you can kind of target treatment better, right? Because everyone can present with the same symptoms technically, but they can all have different types of infections. So treatment becomes unique for the individual, right? What specific herbs are you using? What specific support mechanisms are you using in play? How are we trying to restore balance and upregulate the immune system so the immune system can start to handle these, pathogens or other toxins and enhance detoxification, right?
Sure. So next step would be testing, I presume.
Next step, yeah, so testing, and there's a few other ones I want to just touch upon. So
Yeah, please.
there's anaplasma and uricularosis. You can test for these on conventional blood work, but again, serology. Um, these symptoms of anaplasma will be rapid onset of symptoms, begins with worst headache and worst flu ever, acute onset fever, severe muscle pain, anorexia, cough, congested lymph nodes, so they're like puffy all the time.
Right.
Blood work, you can, if you have elevated liver enzymes, that could be, you know, that could be a lot of things, but it can represent active infection,
Yeah.
right? So whether it's, anaplasma, which is a co-infection, whether it's any type of infection going on too, right? So, blood work does give you some clinical indications, right? Having, lower white blood cells can be chronic infection, but
Yeah.
it's like, okay, what is the chronic infections that we're dealing with
Yeah.
too, right?
I want to ask about that because let's say you do have like a tick bite and there's like an initial infection symptomology that could last weeks, and then let's say it passes, and then the person's good for a while or a long time. Maybe they never have symptoms again. Is it really just like some people are just inevitably going to have like some kind of remitting symptoms coming back? Is it always the case?
Yeah, so basically, so some people like we touched upon, they'll get, say they actually find a tick bite and they're fine.
Mhm.
The thing is to still to treat it
Yeah,
because we always think about the longevity component too. It's like we're up against way more nowadays, right? The whole environment, the whole food and everything else, the stress factor. So we still want to treat it because we don't want those to flourish in the future,
I see.
right? And herbs are perfectly good because they not only tackle infection, but they help so many different factors. Like they help the circulation system, they help the inflammatory response, they're helping modulating your immune system, they're helping with like other anti-inflammatory purposes. So it's not just like, hey, we're taking the herb just to kill this specific bacteria. No, we're taking the herbs because it supports overall immune function, and it's actually supporting our well-being at the same time. It's helping with even detoxification. It's helping with our neurotransmitters. It's helping with, some of these herbs have a lot of phytochemicals. So it's like, it's actually providing us with specific nutrients that we need for the immune system to be like, hey, I'm going to keep my immune system high. I'm also going to work on the components, say, hey, I do have, some sort of organisms that I need to just keep dampening down. But if I keep my immune system, modulated, then eventually it's just like tackling it itself, right? So those people they should, but people, it's like, we use, like, a lot of people take antibiotics and they don't take probiotics and they think they're fine, but later down in life, like, you have a skewed microbiome. That's like saying, hey, my immune system is going to be skewed, and I'm going to open the door to other triggers or other invaders that come in, right? So I guess a lot of people just don't know or understand, it's not just in the given moment to do something. It's, you have to think long term, right? We want to think, lifespan and longevity component, right? That's the goal as well, right?
I think people will look for the peace of mind of like, okay, I'm fine, I'm better now. Better meaning I've gone back to before that trauma or infection. And like last week in a podcast, I'm like, we're the summation of everything. We're not just like going back to like ground floor every time like you just start to feel better.
Mhm.
Everything is like a build, like sediment building, and like you kind of want to keep things as clean and neat as possible because you're building upon that as opposed to just starting fresh like a newborn.
Right. Exactly. Right. So yeah, like I say, it goes back to like a lot of misunderstanding, and then, lack of knowledge, not just from, the general population, but even from, the clinician side, right? Just
Mhm.
there's, it's, yeah, we have Lyme, so, now what? Like, what do I do? Like, how do I treat it? Or what other factors are involved? And that's where it's like, yeah, it could become complex, but it's obviously, yeah, testing is going to be helpful in these cases. But, the whole Lyme field is a clinical diagnosis too, right?
Sure.
So you use, basically, I subclass it into these specific symptoms and be like, okay, well, you're presenting with these symptoms on the highest on the totem pole, let's say. I think it's wise to use more specific targeted herbs to treat, hey, you have rage and anger and anxiety. I think Bartonella, we use Bartonella specific, herbal treatments. But also you still have to understand the whole clinical history of the individual.
Yeah.
Do they need mitochondria support? Do they need dysbiosis support? Is there mold and mycotoxins in play? So
Hmm.
that's like specific binders, right? So even mold symptoms, right? Like how it kind of correlates and overlaps. Severe brain fog, fatigue, depression, dysautonomia, numbness and tingling, worse when snow melts or humid days. That's a huge one. Like, people are
Hmm.
like, oh, I'm allergic to the weather. Well, you're not allergic to the weather. You just have something internally going on that's making you feel unwell,
Sure.
right? Allergies, sensitive to odors, chemicals, linked to chronic fatigue syndrome. So it's like, it's all the symptoms are kind of overlapping, but if you're
Yeah,
having multiple systemic symptoms, man, you really got to think something
yeah.
deeper is in play, right?
So, what are some like factors in a person's lifestyle that would predispose them to like having a bad terrain or becoming sensitive to mold, that which then will lead to a potential, like it sets the table for a co-infection afterwards?
Yeah, so in general, we look at the terrain theory, and then, what's in the terrain theory, okay, what's causing the inflammation? So what's making the body hospital to any infection, whether it's Lyme, whether it's Epstein-Barr, or whatever it is.
Yeah.
So like, nutritional deficiencies, digestive dysfunction. We could look at mast cell activation now and histamine response. We could look at food sensitivities. We could look at immune dysregulation, autonomic nervous system dysfunction. So you know, the whole fear pandemic has set the stage for a lot of, issues for people, has now
That's gonna
triggered,
exponentially
has,
increase now.
yeah, intestinal permeability, We look at production of enzymes, organ and cell damage. We could look at hormone dysfunction, neurotransmitter dysfunction, oxidative stress, endotoxins, microtoxins, systemic toxicity. So there's so much to look at, right? Which is good on our end because we should be examining these factors in the individual to help them
Mhm.
restore balance, right?
Yes.
If we're only picking one or two, it's going to be harder, right? I mean, some people can get away with one or two if they have, maybe smaller infections or there's not much going on in the terrain. But,
Hmm.
some people, if it's been like years and years and years, man, that terrain has become very dysfunctional now. And now it's a layered approach to address these certain factors, right? That's where additional testing can
Hmm.
help, right?
What would be a good test to assess your terrain?
One test or multiple tests?
Let's do multiple. Do it like, let's say someone's coming. Let's do a hypothetical. And there's a kid. He's got a lot of like chronic sensitivities, chronic like food sensitivities, seasonal allergies. Always got a snotty nose, little brain fog, a little bit of ADHD in the classroom. Maybe small in stature, not failure to thrive, but like just underweight, under height, and like outbursts of anger, frustration, that sort of stuff.
Yeah, so I would still, and like if they're having those multiple symptoms, so we're talking about that clinical picture right now,
Yeah,
I would still even like, recommend the tick testing, just like even just testing the three Bs, right?
sure.
Borrelia, the Babesia, Bartonella. Also, I like doing organic acids tests because organic acids tests can give you indication into, hey, do I have any type of other systemic yeast, bacteria markers going on? It can also give you segue into mold, right? So if I find that, there's markers on the oats test like aspergillus and fusarium, if they're elevated, that could represent, hey, I have colonization of these specific molds. That can kind of prompt us into doing mycotoxin testing, where you can test like aflatoxin, orchotoxin, gliotoxin, right? And then in that setting, it's like, well, now we really need to address, am I currently living in an exposure? Is my house contaminated mold, or is my workplace or is my school environment contaminated? Because that's a huge factor. If we're in an inflammatory state on a 12-hour basis or 24-hour basis, it's going to be hard to really get better if we're currently being exposed, right? Because the immune system has just become so dysfunctional. And even if you're trying to tackle, hey, now I have Bartonella on top of that, it's going to be a lot harder to treat because the immune system is so dysfunctional. It's not going to be able to even pick up, hey, I'm doing this herb, I'm going to kill it, right? So the test can help direct you into other areas, but yeah, organic acids can give you segue into systemic bacteria, yeast, potential segue into mold markers. It can look at the neurotransmitters to see if infections are causing the whole neuropsychiatric types of diseases. It can also improve or give you support mechanisms. Do I need methylation support? Do I need extra B vitamins, like specifically like B6? That's very commonly low. That supports a lot of these neurotransmitters. It can tell you if we need extra glutathione to help push detoxification. It can tell your amino acid status, tell you so much, right? So that addresses systemically. If you want to do gut testing, yeah, you can run like a GI map. You can look at, are there any infections directly correlated inside the GI tract that need to be addressed too, right? So those are like key tests to look at everything. I would say full picture. I mean, hormone testing is kind of, if someone has chronic infection, they're going to have hormone issues. So it's like, well, do I really want to run another hormone panel and try
Hmm.
and just fix hormones? No, I want to try and attack kind of the deeper issues and the other terrain markers because, hormones are going to be skewed regardless, right? So if I'm thinking, hey, how do you look at the whole picture? It's like, yeah, organic acid test, it's good because it looks systemically. Yes, GI maps can, or other lab or GI testing can be helpful to look, inside the GI tract. Is there SIBO pictures involved, right? And then again, tick-borne testing can look at, are these other bigger players causing onslaught to the GI tract, causing those GI symptoms? Because we can have GI symptoms, but it doesn't have to technically reside in the gut. It could be things systemically that's causing that inflammation. affecting the nervous system and the autonomic nervous system and causing that distress in the gut, right?
Sure. So interesting. It's just like it's like a rabbit hole. You keep digging, you go deeper and deeper, and there's more areas to discover.
Oh, of course. I think it's what we want to do. But yes, I mean, they do cost and that's fine. But we want to get to the root of it. We want to understand the whole picture, the whole terrain, because this is prompting your longevity, right? We want to be sustainable in the future, like we've been talking about too. It's not just, hey, what's now? It's like, okay, what's now is great, but we also, hey, look at your clinical history and how do we prompt into future health span, we like to say, right?
Does any of this play into autism?
Yes. So autism usually has like a stealth infection involved, whether it is Lyme or other tick-borne infections. It also has like the environmental components to it, right? Environment being like heavy metals, mold toxicity, huge one. And how, again, that's going to disrupt mitochondria dysfunction, right? So that's where, again, the organic acid test, especially in like with kids with autism on the spectrum, ADHD, OCD, they could probably benefit doing one because it can start giving you segue into so many other factors, which is good because, I wish one test can do it all, but at least from our, obviously our clinical learning and education that, hey, this prompts us to do, a mycotoxin test, which is good because now we're putting value into what we're doing and what we're testing too. And we're getting more answers. We're getting a lot of more pieces of the puzzle, which treatment becomes more targeted, right?
Yeah.
With herbs, nutraceuticals, vitamins, minerals specifically, right? But yeah, autism big on the whole chronic infection piece, environmental exposure, right? Massive.
Yeah. Wow. So, I mean, it was a bit of a tangent, but I know you have a structure. I want to let you get back to where you were progressing anyways.
Yeah. So going back, there's two other um, types of co-infections that are more prevalent. So you have mycoplasma now,
Yeah.
right? Mycoplasma, you get crawling sensations under the skin. You get sensitive to touch, sensitive to light. You have chronic asthma, big in kids, big in the autistic world, right? Lots of asthma nowadays, lots of chronic cough, shortness of
Mm.
breath. You have bladder issues, lots of inflammation, multiple neurological symptoms, and these may be found in water damaged buildings, right? Another big thing that's people are not really looking into as well because those organisms now, it's not just mold, it's other bacteria, it's other funguses that are wreaking havoc on the system, right? That are causing things like Lyme, things like other tick-borne infections to thrive in
Sure.
their terrain now, right? And then the last one, mold. I just put mold because it's not a co-infection, but I think it correlates because usually one triggers the other. Again, severe brain fog, fatigue, depression, the numbness and tingling, the multiple sensitivities, the chronic fatigue. If someone's chronically fatigued, that's a pretty good indication, right? So
Hmm.
all these co-infections, a lot of them overlap, but there's a lot of key ones that kind of, point out, right? To be like, hey, you know, you're more on the neuropsychiatric side, hey, Bartonella, or hey, you're having night sweats and air hunger, yes, Babesia. Hey, I'm having chronic fatigue and reoccurring flus and fevers, yes, Borrelia, right? So you can get very, on key symptoms that can help you prompt you to even start treatment without testing too, right? Because again, starting treatment is never harmful. The better, the earlier we start, the better we can restore balance, right?
Yeah.
Then we can actually retest and start to get more, precise. Yes, add in a herb for, Bartonella, add in a herb for, Babesia, or hey, now there's mold. Now we can work on some sort of, use some binders and play, right?
Good. Yeah. Um, I get, I mean, there's so many questions. I mean, how do you know the person's starting to feel better? Is it just like they're feeling less of their symptoms? Is the healing process like 2 steps forward, 1 step back. They're like, I was feeling good, but then I kind of had a flare up. What do you see?
Yeah, so it's exactly what you said there, 2 steps forward, 1 step back, right? Because it's like the layer of the onion. What you treat one thing arises to the totem pole that the immune system starts to pick up, which is kind of good because we want our immune system to actually, hey, turn the spotlight on so we can actually, battle against these guys too, right?
Sure.
At the same time, just they have their support mechanisms in play, right? Supporting their terrain. So we can never put those aside because that's how treatment becomes more effective on someone's, yeah, you're supporting the terrain, but you're also supporting what's coming to the surface at that time, right?
Sure.
So that's where it's like, usually, let's say every 2 to 3 months, right? People are feeling better, but then, they still have, whether it's some lingering symptoms or new symptoms persist, that means, hey, rotate some of the herbs or rotate one of the herbs or even bring in an additional herb because now we have symptoms of, you know, another co-infection. We've had testing done to show, hey, you've had exposure to these in the past. Now it could be reactivated because we're treating, the layers and layers. Depending on the person, they can have multiple layers, right? Some can have, 1 or 2 layers, right? So yeah, the longer someone has been chronically sick too, right? The longer technically treatment is going to be for those individuals, right? Because, they've been exposed now for, 5, 10 years. And now you really got to start working on a gradual, slow basis because those people are now going to have like the whole mast cell activation, the whole limbic system impairment, the whole vagal nerve. So there's going to be things to incorporate other than herbs and supplements that are going to provide other benefits like, hyperbaric chamber or red light therapy. There's specific frequency microcurrent, right? So restoring balance from the vagal and limbic system, how to put ourselves in a parasympathetic state where we're more in a rest and digest, so we have the ability to heal,
Mm-hmm.
more often than not. And that's a gradual process, right? We don't expect, ourselves or anyone else to be like, hey, I'm going to do all this limbic system training and rest and digest, overnight because we all have busy lives and stressful lives. Sure. It's like, how do we incorporate these things that are feasible, that are ongoing, so they can sustain it throughout their lives, right? So we're trying to restore balance from the holistic sides, right? Looking at everything, not just from the supplements we take, but the lifestyle factors we do, and then the other therapeutic, treatments that we bring in that are done, whether it's once a week, like IV therapies, right? Whether it's ozone treatments, whether again, hyperbaric, those types of treatments, how those can be incorporated as, time goes on to extend the healing process too,
Sure.
right? To help them fully heal and, kind of get back to not even square one to feel better than they ever have, right? So
That's good. Even like maybe like throw out some dietary or food choices, things that people really shouldn't be having, and things that are like superfoods. Because a lot of times people be like, well, I don't even know what to eat. Should I eat like organic? Do I have to be gluten free? Like, there's so many concepts and theories. I mean, what in your experience, what have you seen to be really effective, and what are the things that you like run?
So yeah, I think gluten's a huge one, right? Gluten is very inflammatory, especially obviously in North America compared to Europe. We get just, because we're ingesting more pesticides, herbicides, right? That's causing more immune stimulation, which we don't want more immune stimulation. We want more modulation, right? So I think if someone were going to cut out one food today, it's like,
Yeah.
okay, gluten's got to be number one to go.
Are you
Dairy could,
highlighting, sorry, just to jump on it, because you're highlighting the pesticide, like the toxicity or the poisoning really of the wheat as
yeah.
opposed to the gluten molecule protein,
Yeah, I would say
perhaps.
for
It might
gluten,
be
I would say
both.
both for gluten for sure.
Yeah.
Yeah.
Okay.
What pesticides, herbicides, yeah, organic, eating organic as much as we can so
I
we
see.
can follow like the clean 15 and dirty dozen, because of, cost of food or geological location we're in, what we have access to. Autoimmune paleo diet is a relatively good anti-inflammatory diet where it's, it's more like your wild fishes, your grass-fed beef, your
Mm.
Mennonite chickens, right? So you're getting a lot of nutrients from those sources, plus you're eliminating, the contaminants of, the antibiotics, the pesticides, the herbicides and whatnot. What I also find interesting in, people who are chronically fatigued or have, in the cases of even autism, I would pull grains from the diet because grains have molecules that can hinder the mitochondria, right? So we tend to, you know, pull grains out or, limit grains, right? To
Mm.
provide because people are going to have mitochondria issues. So without doing, you know, more mitochondria supplements and whatnot. It's like, how can we work with the diet that's gonna, yeah, provide us with food density, right? Nutritional status, but how do we help even from a mitochondria standpoint? We tend to pull the grains out. And we know grains can be, somewhat contaminated with, specific molds or heavy metals and other pesticides and herbicides, right? So we're trying to think like nutrient density per meal, and your whole animal-based diet is, I think, is very key to healing, like even a proper keto diet, because we need fat, we need saturated fats to support our cell membranes. Without our cell membranes, we don't have proper neurotransmitter support, we don't have proper saturation, we don't have proper blood sugar regulation, right?
Sure.
So diet affects all those, right? All those metabolic functions, right? So yeah, gluten, number one, right? From the wheat standpoint, also from the pesticides, herbicides, you get into the organic side, eating as much as organic as possible. Dairy, I mean, depends on the person. If they're eating dairy, I mean, it's very limited, or they're doing, just like the proper sources, like, grass-fed butter can provide a lot of butyrates, which could be helpful for the GI lining, those short chain fatty acids. That's great. But we don't want to overdo it on that standpoint either, especially if they have a lot of GI symptoms or a lot of, you know, mucus or phlegm or mucus in the stool, just because
Mm.
you're adding more mucus, which we don't
Yeah,
want either, too,
exactly.
right?
Okay.
But yeah, autoimmune paleo, limiting the grains for people that have these mitochondria issues, especially again in the autistic world where all these tics and spasms and rages are a lot of mitochondria components. So we want to limit those too, right?
How would you, what would be something to benefit the mitochondria, like supplementally?
Supplementally in food. So from a food standpoint, we can always consider drinking pomegranate juice. Pomegranate juice can, has, multiple benefits on the whole cardiovascular. It helps with like the oxidative stress component, which,
Mhm.
we all have some sort of degree of oxidative stress.
Sure.
Lots of people have like metabolic issues like high cholesterol, right? So it
Mhm.
can help with like the lipid peroxidation component of it as well. Dragon fruit. So if we're thinking of a superfood, I like dragon fruit. So papaya, one of those words.
I'll look it up.
Um, that's another word is dragon fruit. So it's like
Yeah.
that, that's red kind of yellow, white inside with the
Yeah.
seeds.
Yes, yes.
What's benefit about that is that can support the microbiome, which can support Archimendria growth too at the same time, which Archimendria is like one of these now well-known studied specific bacteria strains that supports neurological health, supports the
Mm.
whole terrain aspect. It's a keystone species, right, as well.
Okay.
Supplemental wise, I mean, there's lots of mitochondria support supplements. Like you get into the whole acetyl L-carnitine or
Mhm.
L-carnitine, right? That basically is driving, the fatty acids, the essential fatty acids into the cell, so the cell can utilize it to make ATP, right? You
Right.
get things like alpha-lipoic acid, you get things like N-acetylcysteine, you get your CoQ10s and your ubiquinol. So those are like your major, I would say, antioxidants that support mitochondrial health, and then specific B vitamins like B6, for example, or even benfolamine B active B1. And you can use those in specific cases of, say, hey, I have more neuropathy conditions. Yes, we can do more, benfolamine active form B1 to support that additionally, right?
Oh. You clearly have a ton of expertise. And I mean, you were correct earlier when you were saying there's a lack of this type of education in all the medical schools, the school I went to, because a lot of this is like brand new to me, or it's something that you kind of tread through and you hear little bits, and then maybe that person you're learning from, they don't have the full picture. Whereas you've done exhaustive research and you had a lot of clinical experience helping people with all these co-infections, Lyme, mold, um, behavioral concerns. So I've been really impressed with all your study, your research, your content that you're providing. If people don't know, I've added Julian to our Tri-Health team. He has his own private practice as well. Um, really impressive. I mean, we have to do parts to this because I've always wanted to do a deeper dive, because a lot of podcasts, like I mentioned earlier, we skim the surface. We just talk about little key points, but people then they're coming back to me on social media like, okay, but what do I do with that? Like, how do I test? What supplement? So that's why I really wanted to hyper focus on a few key points today, dig in a little bit, take a bigger scoop out of the ice cream bucket. That's not that I'm promoting dairy. And it was really insightful. Is there anything that you want to like throw out as like a parting thought, or any other areas that we should investigate until the next time we do one of these?
Yeah, and I think people who are just continuously to feel unwell should even think about these things, right? Co-infections, mold exposure, right? So we want to educate them so that they start to understand, right? And then they're able to get help, right? But they're getting help in a more targeted way, right? Without, kind of, beating around the bush, or just doing simple therapies, because these aren't technically simple therapies. Well, they are, they're just way more targeted, right? The whole gut issues, like, are probiotics going to be the game changers in these cases? Probably not, right? So that's where it's like, if people understand, hey, these symptom pictures, and say, hey, now we can finally test for these. Now we can understand what's causing, again, it's always looking at what's causing the immune system to be dysfunctional, and what's causing the immune system to increase that terrain aspect, right? And how do we promote treatment that becomes more targeted, right? But I think it's more prevalent nowadays, these infections, or lots, whether it's Lyme or whether it's even other, like Epstein-Barr, or even, cytomegalovirus, or any other viruses, is like, how do we work with that, right? And restore balance in the future, and how we become more precise and targeted, right? So the more education people have on this now, the more proper testing they can get, right? The more targeted they can be, the more likely they're going to restore balance from the longevity component, right?
Fantastic. Yeah, I think we have to increase the precision of our testing, and with, your expertise and people learning from people like yourself about understanding, like narrowing down your focus so that you actually can get much clearer picture, as opposed to like a very broad stroke, like, oh, let's test, stool. Okay, yeah, you get some info, but was that hitting the bullseye? Maybe not. Maybe with, what your understanding and what you've been developing, now we can zoom in a little bit closer and, save the patient time and money so that they can start feeling better faster.
Exactly, because people are just going to keep, I would say, spending money on supplements that are not needed for their own core uniqueness of what their immune system actually needs. That's why I say, like, everyone's like, take a multivitamin, take a probiotic, take a fish oil. But if you have chronic symptoms, I doubt those are going to be doing anything for you in the long term. So it's like, put those three aside, or don't repurchase those. Let's repurchase things like a test, or specific supplements that are actually going to be to your uniqueness of your terrain, your past history, and what's currently going on with the immune system, to help promote, again, the longevity component, right? So
Yeah.
whether it's herbs, whether it's nutrient status, whatever it may be, we're all so different. We all need specific things from our uniqueness, again, from our exposures and what we're currently dealing with, to help restore our own unique balance, right? To help pursue life in that way.
Perfect. Thank you, Julian. As always really impressed with everything that you bring to the table. I'll have everyone's contact info on the bottom, and we'll do this again really soon.
Yes, looking forward to it.